Well, Commissioner Fuller, thanks for your time. It's a very challenging time for Sydney and New South Wales, isn't it, at the moment?
Yeah, look, absolutely. And the Delta variant of COVID-19 is stretching New South Wales, but it's stretching also a number of countries across the world.
I just wanted to ask you about the role of police in the Sydney lockdown. Last year you were criticised for going too hard. We had those shots in Rose Bay of police cars driving into parks and people were sunbathing and forced to move on. You copped a lot of criticism at the time, but it worked, didn't it? Should we have gone harder this time? What's been the approach of police during this lockdown?
Yeah, thanks, Andrew. Look, it was a challenge early in the piece, and the health orders were something that police had never seen before, and the community had never seen before. And there was certainly rub in that first week, and I think we levelled out to a really sensible level of enforcement. I think the game changer in this is really just the transmission ability of the virus itself, and I think it caught the world off guard. And in terms of policing it, it has been a real challenge because in the past the virus has spread through the entertainment industry, our pubs and our clubs, but at the moment it's spreading faster in homes than it is anywhere else.
Well, tell us about southwestern Sydney. What have been the extent of police operations there, and what sort of things have they been doing to, I guess, stop people going out to other homes, etc., or places they don't need to?
Well, the operation commenced nearly 2 weeks ago in southwestern Sydney, and now it has branched out and it's right across New South Wales. And to be honest with you, the compliance out in the street and at workplaces in southwestern Sydney is extremely high, and non-compliance, we're seeing more around the beaches and north and south of Sydney, and of course those who are leaving Greater Sydney into regional New South Wales without cause. So they're the majority of the breaches. We're writing between 200 and 250 tickets a day to people who have no regard for the health orders or no regard for the health and well-being of their neighbours, friends or family.
Could you have done a ring of steel in Fairfield, or it's just so different from the northern beaches? There's too many roads in and out, you just can't do it.
You can't do it practically, and again, if you look at some of the times that like the northern beaches, it had sort of a couple of key points in and a couple of key points out, which made it very easy to police. But Fairfield, as an LGA, it was practically impossible to put a ring of steel in. And at the same time, again, if you think about the way the virus is spreading at the moment, the ring of steel wouldn't have worked. I mean, we don't police inside people's homes in terms of enforcing health orders. And I really think the messaging, Andrew, at the moment is so important in terms of people really staying home and understanding that if you bring the virus into your house, you're going to give it to a loved one and they may die.
Could you have done a ring of steel around Sydney? We heard Dan Andrews this week, the Victorian Premier, call for that, and I guess we've seen it escape to the regions. How possible would that sort of operation have been?
So at the moment, our understanding is it's gone into regional New South Wales, particularly around Orange, from a transport worker who was taking, essential foods into that area. So I think there's a real challenge in this idea that the virus is moving around by people who are breaking the rules. But we need petrol in regional New South Wales, you need food to be delivered, you need medicines, a whole range of things that need to come from, many come through our international airport through air freight, and they have to be transported.
You were talking before about this situation when bringing it into the home. I couldn't help thinking then about that poor Iraqi family where the mother died from the virus. The two young gentlemen were removalists. That's the sort of case you're talking about, isn't it? Maybe more members of a family living in a home.
Absolutely, and then if you have other close family members that are nearby in walking distance, and you might go out for a walk and then you drop in and you see them, and then there's quite a big family living in that house, you spread the virus, and you end up, as a byproduct of that, is someone being in intensive care and or dying of it. And at the end of the day, we can talk about ring of steels, we can talk about a heavy police hand or a light police touch. There's only one way out of this, and this is vaccination, Andrew, and people need to get on board with the concept that in Australia at the moment there are two types of vaccinations, and that's obviously AstraZeneca and Pfizer, and people need to continue to put their hand up to get the vaccine. Because the way the Delta variant is running through, particularly Sydney at the moment, is that I can't see us getting down to zero for some time.
Well, from what you've said, you've half answered this question, but let me ask it anyway. The numbers don't appear to be shifting too much, even with these tough restrictions. Are police ready for a situation where there are always virus numbers in the community and basically always a need to enforce some restrictions?
Look, we've had restrictions in place now since March last year, and when the health orders came in, Andrew, to be honest, I thought they would be around for a few months. I don't think anyone saw the evolution of COVID running now, from 2020 well into 2021, and really we are hanging our hats on vaccination rates exponentially growing, September into October, particularly in New South Wales. We're a big force and we're growing every year, which gives us the capability to continue to run hotel quarantine and ramp up escalations in health orders if necessary. And I think we've showed an enormous amount of resilience and ability over the last 16 months.
I mean, is it fair to say there were too many loopholes in the health orders that Health and the Attorney General, etc., put together? First of all, before that Northern Beaches shut down, when air crews didn't even have to quarantine, did they? And secondly, with this requirement not to have to vaccinate or even mask up for this aircrew driver?
Look, there were certainly guidelines, and if the driver had followed the guidelines, he would have been wearing a mask. And look, this is not just a few weeks into this global pandemic. We're 12 months in. People had a very good understanding in terms of expectations if you were in or around hotel quarantine. And yes, if the health orders were slightly stronger, but the difference is that if the orders were a little bit stronger like they are now, then I could have issued the driver a $1,000 ticket for not wearing a mask. That doesn't guarantee that people aren't going to be complacent. So, look, from our perspective is that, we missed out in issuing this driver a $1,000 fine if he was the zero infectious person in relation to it. I accept that. And I think the community would have felt some satisfaction that someone was held to account for the Delta virus being brought into New South Wales, and I have to accept responsibility for that as the person who's running hotel quarantine broadly.
Just generally, across the board, are the public health orders as strong as you'd like on around COVID and as unambiguous as you like? Because we know they have to be drafted fairly quickly at times.
Look, I think police commissioners always want stronger powers, Andrew. There's no doubt about that. But I'll give you an example today. Is that we saw that there was a loophole in relation to people wearing masks, and they were giving police the reason it was for medical reasons, and they weren't showing that proof. They didn't have to show the proof. So, went back to the Premier. She went to the Health Minister, and that was amended. So, if you say to a police officer, I don't have to wear a mask because I've got a doctor's certificate, then you've got to produce that. And if you don't produce it, then you'll get the $200 fine. So, we have to tweak them, and you're right, they are rushed sometimes, and there are lawyers overnight working to strike the orders, and then at the same time, police are trying to operationalise these orders to say, are they fit for purpose? Are they going to achieve what the Premier's intent in relation to slowing or stopping the spread of the virus? So, absolutely there's been challenges with the health orders. I can't deny that. But the government is always open to the amendments, and we saw a really important one today.